Good morning, good afternoon, welcome. It is a pleasure to be with all of you today. Welcome to our UPS Healthcare Trends and Challenges in Healthcare Logistics in Mexico. My name is Luisa Boyce. I'm Vice President of Global Public of UPS, and I'm very excited about the webinar today. This is such an important topic for us, for all of us, for the health and here in Mexico. And we are really looking forward to the conversation today. Have a conversation in Spanglish, English and Spanish throughout the conversation. And I'm excited for the topics that we're going to discuss and how we're bringing thought leadership to this very important topic. For UPS, healthcare is a priority, is about our patient, it's about patients and it's about how to improve their quality of life. And there's so many policy and key issues to converse. So I'm very excited to give the opportunity to have a conversation. If we move to I have great three speakers that are going to today, and I'm excited to have them be with us and be able to have a conversation where we hope to answer all your questions. Please questions and put them in the either in the chat or in the Q&A box. We'll address them towards the end. And to begin with, I'm excited to first welcome Juan Carlos Ruiz, healthcare commercial specialist from the U.S. Commercial Service Mexico, U.S. Embassy here in Mexico City. Juan Carlos, welcome. Juan Carlos is an experienced economist with over 20 years of experience. Like me, Juan Carlos started when he was 5 years old, right, Juan Carlos?
Yeah.
And full of wisdom. Um, and Juan Carlos, how that he plays within the U.S. Embassy in Mexico and has an area of expertise that he brings to the table. Juan Carlos is going to give us an overview, a strategic overview of the healthcare sector, where we are, what are the areas that we're seeing. And I know, Juan Carlos, you're here. I cannot see your screen, but I know you're right here. I'm going to add you. It's really a pleasure to have join us, and I'll introduce Hector and Susie in the next panel. But Hector, welcome too. I'm very excited to have you both here join us in this event. And by the way, I do want to say thank you to those that are joining us live and those that are watching us afterwards in the recording. Um, so Juan Carlos, welcome to the conversation. Really a pleasure to have you, and thank you for providing of what are we going to discuss later on. Thank you.
Thank you, Maria, and thank you to all the UPS team. I'm really pleased to be this morning in this webinar. This is my first time participating in one of UPS webinars, so I hope this is not the last one. And I'm really happy to be this morning to provide some kind of context about the healthcare market in Mexico, and also about the importance of the relationship between the US and Mexico, because given the integration of our economies, I think for the subject that matters today, which is logistics, it is important to create some to put in place some background about how both economies are integrated. So if we can go to the first slide, please. Thank you very much. So the United States and Mexico share more than a 3,000-kilometer border, or in terms of miles, 2,000 miles. They share a deeply integrated economy, interconnected supply chains, and a common interest in regional competitiveness. Over the past 3 years, trade between our countries has expanded dramatically, transforming North America into one of the world's most dynamic manufacturing and commercial regions. One important figure that we usually highlight is the amount of trade that every day takes place between Mexico and the United States, which is about $2.5 billion, which gives you an idea about the importance of logistics for this bilateral trade. So can we go to the next slide, please? So again, we are talking about integrated economies, the North American region is one of the most dynamic ones in the world, because we are not speaking about only trade, but supply chains that are economically integrated, production centers that are located in the three countries and that need a very efficient supply chain and of course a logistics services that can face all the challenges and that can support the three countries at the same time. So can we go to the next slide, please? So in terms of the importance of the Mexican economy, as we can see in this slide, we are speaking about one of the largest economies in the world with around 130 million consumers, which highlights the importance of the Mexican economy for the US one in terms of consumption and demand, and of course, in terms of bilateral trade. Next slide, please. As we all probably know, Mexico has very different regions in terms of specialization. In the case of the North, as you probably know, we have the advanced manufacturing centers in the northern states where the majority of the manufacturing takes place. Also in the Bajío and the central regions of the country, we can find several industrial clusters like the automotive and also some of the services which are located in Mexico City, which is the financial center of the country. And of course, the south part of the country is the less developed one, which usually specializes more in services like tourism or some energy production. Next slide, please. And of course, the backbone of the relationship between our two countries is the USMCA agreement. Of course, this, has agreement is the result of the renegotiation of NAFTA and has modernized regional trade rules and strengthened North America's ability to compete globally. The agreement promotes investment, supports innovation, enhances intellectual property protections, and creates greater certainty for businesses operating in the region. Next slide, please. One of the main aspects of our relationship, of course, is nearshoring. That, uh, uh, of course, with nearshoring, encourages companies to relocate production closer to the North American region, which create new opportunities in manufacturing, infrastructure, healthcare, water technologies, digital services, and of course logistics, because by transferring manufacturing production to Mexico in this case, it will create opportunities for logistics companies like UPS in this case to provide services to for the trade that is going to take place between the three countries. Next slide, please. We also like to talk a little bit about what is happening right now in Mexico. Of course, the political situation is something to talk about. What we are seeing here in the commercial service is some aspects like the centralization of power or the concentration of power by one only party, which is Morena, the ruling party here in Mexico, which has caused some regulatory framework that is a little unpredictable right now in terms of the healthcare market. We're going to see later on how the regulatory framework that exists right now in Mexico is one of the biggest challenges for the industry. But on the other hand, we are also seeing some alignment from the Mexican government towards the US as opposed to other countries as China. Next slide, please. An important aspect to consider also for doing business in Mexico is the organized crime, which can be embedded in several economic activities within the country. So that's the reason why having a right logistics companies can avoid some of the risks presented by security in Mexico. And of course, companies here have invested in several aspects to avoid the security risk that presents the country. Next slide, please. Of course, there are some challenges to consider when doing business in Mexico. Of course, there's the border congestion because the majority of the trade done between the two countries is done by the Laredo cross border. So that gives an opportunity for logistics companies to look for alternative border crossings to provide services to their clients. The regulatory and legal uncertainty is certain right now, so companies should take this into consideration when doing business in Mexico, and of course some IP related issues that can face companies also in this country. Next slide, please. So now I'm going to talk about the healthcare sector in Mexico. Of course, Mexico, as I mentioned before, is home to more than 130 million people and has a healthcare system that combines public and private providers. The sector plays a critical role not only in improving health outcomes, but also in supporting economic development, innovation, and employment across the economy. Next slide, please. So how the sector is integrated, of course, there's on one hand is composed by public institutions, including the Instituto Mexicano del Seguro Social, which is the Mexican Social Security Institute, which serves the majority of the formal private employed people. There's also a social security system for the government employees, which is called the ISSSTE. And there's the IMSS Bienestar system, which tries to provide healthcare services for the rest of the population in Mexico. Together, all these three public institutions provide healthcare services to millions of citizens, sorry. And in recent years, the government has focused in expanding access to healthcare, particularly for underserved and rural populations, while seeking to improve the quality of service and the healthcare services. And of course, we have the private healthcare providers, which serve an important segment of the population, the majority of them middle and high income population, which usually look for a faster attention by the healthcare system. So recent government reforms have aimed to provide universal healthcare access and digital coordination among the whole system in general. Next slide, please. So what are the key market drivers within the healthcare sector in Mexico? Of course, there's an aging population, which is subject to a higher number of chronic diseases like cardiology-related, oncology-related, obesity, and long-term care healthcare services. Another important market driver is the expansion of private hospitals. As I mentioned, there are several private hospital groups here in Mexico, which serves that population that looking for quicker attention and that have the resources to invest in private healthcare services. And there's an increasing investment in telemedicine. Everything that has to do with technology is in fashion right now in Mexico because that allows to reach people in remote areas of the country. So by providing telemedicine services or AI-related healthcare services, the government is looking to reach those groups of the population that don't usually have access to healthcare services. Next slide, please. In terms of the leading subsectors, of course, the medical devices and diagnostics is one of the top ones. Mexico is still an important importer of medical devices and equipment for the healthcare sector. Another important subsector, of course, is healthcare logistics, and that's why we are here today. According to some consulting firms, the healthcare logistics market value in Mexico is valued around $2.2 billion, which can give you an idea of how important it is. Another leading subsector is biopharmaceuticals. Several companies are now focused in providing this type of drugs to the Mexican healthcare system, and of course, again, the digital healthcare subsector. Next slide. Of course, there are many different investment opportunities. Private hospitals and other services are investing a lot here, given the growing population that is demanding healthcare services. There's the supply chain diversification. I already talked about nearshoring, so that has transferred manufacturing operation from healthcare related companies to Mexico, and that provides some more integration between the US and the Mexican industries in the healthcare industry, so that will open more opportunities for investment. And there's also a new infrastructure that is needed right now in our market. Of course, hospitals, clinics, diagnosis, all these segments of the industry are presenting the majority of the investment right now. Next slide, please. So one of some of the most important market challenges, of course, is the fragmented healthcare system. Right now, the government is putting a lot of effort in integrating the different institutions, healthcare institutions, so they can do common, procurement and purchases of services and products and equipment, which will shorten times of delivery and improve services among all the population. We also face in Mexico workforce shortages, so there's the need for, of course, for healthcare related workforce. And of course, there's always the pressure on the public healthcare system, not only by the high demand, but also by the limited budget that the government has right now to invest in the system, and also by the current and aged infrastructure. Next slide, please. And well, in terms of the competitive landscape, of course, as I mentioned, we have the leading private hospital groups that are continue to expanding all around the country. We have the majority of the top pharmaceutical laboratories and medical devices with presence in Mexico. So all these companies demand very high quality logistics services in order to provide their products to the Mexican client. Competition is increased, of course, from Asian suppliers, but it is well known that the quality from the US market is very good compared to these products. And innovation and service qualities remain as key differentiators within the sector. So I think in this case, US companies have a very competitive advantage against other countries. Here are some of the key opportunities in terms of products and services that are demanded right now in Mexico. I think that I have talked a lot about this. One of the opportunities is to strengthen the regulatory framework, which is controlled by the by the Ministry of Health, and more specifically by COFEPRIS, which is the regulatory agency that approves and authorizes all medical devices and pharmaceuticals. So that's an opportunity there to improve the timeline of the approvals of products and services. And of course, there are different events that happen here in Mexico, trade shows. So I invite you all to participate in different events that we have as this webinar to learn more about the opportunities in the sector. Next slide, please. And of course, I would like to thank again UPS for the opportunity here at the U.S. Embassy in Mexico. We are here to support your business, to support U.S. companies entering into this market. And also, we are interested in supporting Mexican companies that would like to invest in the U.S. healthcare market as well. So here's my contact information. So I invite you to contact me whenever you want. And now I will turn it back to Maria, and I'm glad to answer any questions at the end
Carlos,
of
sí.
this session. Thank you very much for the
Muchas
opportunity, Maria.
gracias. Thank you so much. Muy interesante, very interesting information and the view that you're. Now I'm gonna welcome Susie Balzac to join us, Hector, and let me put you guys so we can be side by side. Um, uh, and for me, it's really a pleasure to be uh, here with these two amazing individuals. Héctor Valle, Executive Vice President de la Fundación Mexicana para la Salud. Héctor, bienvenido. Muchas gracias por estar aquí con nosotros. Voy a dar un poco de tu biografía, pero quería resumirla así a grandes rasgos. Tienes más de 33 años de experiencia en el sector. You have worked in Novartis. I'm going to Spanglish. I'm sorry. I haven't had enough coffee. Where you work with Novartis over 12 years in different. You were one of the founding individuals of Salud, a lot of experience in the area from a policy, from a regulatory, from getting to the patients. Hector, thank you so much for being here. And then Susie Walczak. Susie, welcome. Thank you so much for being here with us today. Susie is our Director of Sales for PS Healthcare and understands logistics like the back of her hand to really also 2 years of experience, Susie, of working on how we move products, right? And how do you move products back and forth? And with that great presentation that Juan Carlos gave us, and before we start, I wanted to first, Hector, maybe ask you, share a little bit with us, what is the Fundación Mexicana para la Salud, just to give a context for people so we can go deep to the framework and the statistics that Juan Carlos was able to give us. And
We're a think tank. We were born 40 years ago. It was designed and built by Dr. Guillermo Soberon, who used to be a Minister of Health in Mexico, and he also used to be the Dean or the CEO and Chairman of La UNAM, which is the most relevant university in Mexico. We're a think tank in public policy. According to the University of Pennsylvania, who ranks the think tanks, we're the #1 think tank in public policy in healthcare in Latin America and the 12th globally. So it's a pleasure to be here and happy to share with you a little bit what we're seeing in Mexico. So happy to be here. Thank you.
yeah. Hector, thank you so much. And so important, right, that we keep an eye on what we're looking at and how are those policies being discussed. And Susie, from your perspective, maybe let me just to set the stage a little, have a conversation. Before we go maybe to Hector in terms of what he's seen, the trends that he's seen in Mexico, from a logistics perspective, how do you see the logistics evolve to support um, healthcare companies and be a differentiator in, as we heard, from medical devices or pharmaceuticals? What have you seen at a high level?
First of all, I wanted to say thank you for putting this event together. This is, I think, an amazing forum for everybody to expand the footprint into Mexico and start doing more of a trade shift. So I want to thank the whole team for putting this together. Now, a few years ago, the logistics was basically a cost item, right? Now, because of the volatility of the market, it's basically a boardroom conversation. Logistics is supremely complex, especially when you're dealing with a cross-border, like Juan Carlos mentioned. The requirements are changing, the raising expectations in terms of service and visibility that the customers want to see. So if you're in this space, you need to completely change your perspective on how you view supply chains. Because what's today is not going to be tomorrow, and the next day is different, right? What keeps you apart is your ability to be flexible. And that is a key component. Now, what really differentiates a strong player in this market is how can you really adapt and remove complexities for the company or for that healthcare sector, right? If you think about cross-border, like Juan Carlos mentioned, you have the cross-border, the cold chain requirements. If now there's a lot more specialty in terms of pharma or chains of custody, as we transition to new medications and new technology, that complexity rises. So there was a gap before. Now, anybody that is going to be a player in this space has to ensure that you have a global connected supply chain, right? That stems from manufacturing all the way down to the patient. Now, before it was at the hospital level, and now that model has completely changed, right? So it's now ensuring that there's a continuity to the actual patient at the convenience of their homes. And the fewer handoffs that you have throughout this whole supply chain is really going to be the strategic differentiator in this market.
Thank you, Susie. Thank you so much. So I love that you're talking about the complexity and the agility, but Hector, you're seeing it from a policy perspective, right? You're seeing what is the impact, and I would love maybe to hear first your how do you see right now the landscape for the healthcare industry in Mexico? How have policies impact or the trade agreements and the negotiations? Because yes, like Susie said, I call it my novela, a trade and a customs nerd, so I live it every day. But would love to hear perspective. How do you see this and from the Fundación perspective?
Well, first of all, I would like to share that we've been working with the Ministry of Economy and the Ministry of Health, and we're seeing two things happening. First, how can Mexico work together in helping the US reduce their dependency on China and India, okay? Mainly China. And we've been working with Minister Ebrard in that. And he asked us to prepare a document that we've worked with it in understanding what Mexico can do. I would share with you that Mexico has the ability of working in producing generics for the US market, which I think it's quite relevant. And also, AIPs, it's a little bit more challenging. We have an industry that we have to develop, but generics will be able to produce. We've gone down to a list of 20 that represents 72% of the possibility of Mexico to really deliver some value to the US. Products like ondansetron, like clonazepam, like lorazepam, like levofloxacin, tacrolimus, or pantoprazole are some of the products that we've been working to make that happen. In the case of medical devices, Mexico has a very relevant industry of medical devices, which all works in very close to the U.S. Frontier. We have very important production sites from Siemens, from Medtronic, from Philips that are based basically in Tijuana, Mexicali, and Chihuahua. Okay, and those are really an area where Mexico is producing a lot of the medical devices that are used in the U.S. and also worldwide. We have to be very proud of what's happening with that industry and how it evolved over the past years. We're now actually working and trying to make sure that from the pharmaceutical standpoint, we're able to deliver a business to support the local production sites in Mexico to be able to deliver to the US and also to be competitive when we look at what happens in the US and all the big dependency they have from China and trying to help in that. So that's a mandate we have from the Minister Ebrard, and that's a project that FunSalud has been working together with the industry and has a big impact and will have a big impact for the benefit of seeing Mexico grow in that arena. We'll see, and that would mean, and we've already seen proposals of doing investments in Mexico, in plants, in sites, in production sites, to be able to cope with that, which I think it's going to be quite interesting. If you look at what has happened over the few, I would say, maybe the last 2 months, you've been seeing in the Mañanera different pharmaceutical companies coming to President Sheinbaum announcing big investments in production sites, okay, which I think it's quite relevant. I see that the local regulatory agency, COFEPRIS, has been improving. I'm positive of the changes I've been seeing. I'm positive of what el comisionado Víctor Hugo Borja has been doing. I'm already seeing benefits in how fast some registrations are coming into the market. And that's, I think, good news. Mexico improving the regulatory agency, being able to do things faster, and that will help the national companies or the companies having production sites in Mexico, and also companies worldwide that are based in Mexico to have a better regulatory process, and that putting products in the market faster. And that applies to pharmaceutical industry, but also to medical devices, which in FunSalud, we work together with both of them.
I'll throw a fun fact. Sorry, just a fun fact for the audience. Mexico is what, the 7th largest medical device exporter in the world, #1 in Latin America. So nearshoring is here. So just a fun fact for the group.
Yeah, I think this is important, Hector. Thank you so much, and for that perspective. So from a U.S. healthcare perspective, we are very mindful as in about not only yes the logistics, of course, how do we move it, and I'm gonna add a little bit more about how do we move those critical temperature sensitive healthcare products. We're also very about, to your point, Nectar, about that policy conversation to make certain that we're at the table to say to the regulators, hey, let's have this into consideration, right? How this look paper, but how does it look in on the implementation? So we love the work that a think tank like yours is doing, because it's important voice to have at the table, and we're doing it also from a UPS Healthcare. We're at the table. Yes, and also in Canada, we're following the USMCA conversation very closely and working with our peers on that piece. So maybe and for that, Susie, moving to you, can you share with us, when we're thinking about temperature sensitive healthcare products that have to move across the border, what are the critical considerations that you take into consideration, the redundancy that can address some of the challenges that Hector mentions too, that there is to make certain that things are implemented effectively?
Perfect. So in my perspective, right, hands down, product integrity end to end throughout the whole cycle is one, or maybe the most important consideration for any company. You can have the best manufacturing site. As we see, there's a lot of healthcare companies transitioning to Mexico or opening up their manufacturing site. But if the end product, be it medicine, product, med device, anything that at the end of the day is going to be an impact to the patient, it doesn't arrive in the same condition, everything else becomes irrelevant. Now, in healthcare, we say the margin for error is essentially zero, which adds to the complexity of moving it across the border. So think about temperature deviations. If you have temperature sensitive, the more handoffs that you have, any gaps in that handoff can potentially impact that product, right? And at the end of the day, we can have a bigger issue in our hands if compliance is not followed to the T. So if once you move across the border, as we can see with what Hector is mentioning and Juan Carlos and the government, the compliance changes and the laws changes basically very, very frequently. So having a provider that is on top of all of these regulations and understand the impact, managing this temperature sensitive across the customs, across the chain of custodies, and ensuring that with all of that, we're still meeting the times in transits, right? Which adds that level of additional complexity. Sorry for the redundancy. It's the whole journey that needs to work together. So it's not really the conversation about transportation, it's about the control and the visibility that you have with the shipment. We have different products at UPS Healthcare, right? That we have that continuity, but any temperature sensitive product that you're moving maybe across the border or anywhere else needs to be able to have some sort of intervention, especially when you have that temperature sensitive product that you need to have ensure the integrity across the whole supply chain.
Mhm. I love that. And for me, that is so important, right? To have that visibility and that tower that we have dedicated
Control
to
tower,
all our
correct.
products everywhere, just to make certain. And Hector, I'm gonna bring you here to bring you something from the past, this experience, and also, of course, where you are right now. But something, and for the companies that are small, medium-sized businesses that are thinking to be on the healthcare or they're in the healthcare process, how do you see your members or how do you see the industry managing inventory, maintaining business continuity, dealing with the regulatory changes, and making certain, of course, they continue the level the occupations, right, that are needed. What is that practical sense that you have from your the fundación that you're seeing that is important for companies to be aware of?
I think that we as everybody knows, during COVID time, it was a tough time. And then the pharmaceutical industry, as several other industries, and also the medical device industry had some shortfalls, shortfalls that had to do with lack of production, closing of sites. And that evolved over the few years after COVID. And now we're seeing some impact from war in Asia, okay? So there's some of the active principles that sometimes are difficult to come into Mexico. I think it mainly has to do with the war and the complexity of going through the Gulf of Hormuz and for some of the resources coming from Asia. When things come from Europe, I see there's no disruption at all. When things come from the US, there's no disruption at all. But it's basically active principle coming from India and from some of the geographies that are a little bit more complex. Okay, that's the only place I see disruptions. The rest of it's going nicely. I think now everyone has to be comfortable that things are working. Also, the importation process regarding COFEPRIS has improved a lot, as I was saying. So COFEPRIS, that was a little bit slow in giving out the permits to do the local importations, were a little bit slower a few years ago, and now they're working on the right pace. So I'm positive that things are going to come back on trains as back on the normal pace. With the complexity of war. And as soon as that gets solved, I hope it gets solved quick, then I think it'll go back and things will be nicely done. I also think there's a big impact of how the world it's defining more for the medical devices, or the chip sector, and semiconductor sector, which has an impact in that industry. And as production moves from one side to the other, that would be changing. But I'm positive, as I said before, that things are going to come back on track, and we'll see all the process with basically with no big issues. Then there comes the local complexity that has, at this point in time, nothing to do with logistics, really. It has to do more with the process of how the government is buying and how they put together the buying process. And after the buying process is solved out, then we'll be able to match again and have in time during a surgery, for example, everything that's required. But it has nothing to do at this point in time with product coming into Mexico or with logistics. It has to do with the buying process And as soon as that gets solved, then things will come back into the hospitals to make things happen nicely for the different patients, specifically in the public sector.
Mhm. Hector, thank you so much. That is so interesting what you're talking about, and I think in our from our perspective. So I'm based here I'm based in DC, in Washington DC, and we're seeing how we are seeing an alignment to really strengthen that supply chain between Canada, US, and Mexico, and have an aligned regulatory process, access to the critical elements or minerals and API, everything that comes into the different sectors. We do see that conversation happening between the three governments, right? In terms of how does that align so that they can be more competitive. So I think that what you talk about is very important, and the medical devices being the statistic that Susie shared with us, right? Such an important role that Mexico plays. It makes more critical that that supply chain is really addressed and assessed from a just perspective. I think maybe if I move from, as we're listening to this conversation, and Susie Hector is leading the conversation, helping the industry on the policy and the regulations. On your side, you're working, making certain that the goods are moving, as Hector is saying that they have to move, right? And
We have
and
to move.
and Juan Carlos gave us the overview. I would like to ask you what capabilities, if you if any, what should companies prioritize when evaluating logistics partners, but what do they have to have in mind and ready to move? Because I think I used to work at customs, U.S. Customs and Border Protection. I see more happening, right? In partnership with FDA and others. From a U.S. perspective, we're seeing changes in governments. Where do you see those two things in terms of need to be mindful of, and what do they have to be ready to have ready?
That's an excellent question, and I was thinking really hard about this one, right? I would say the first thing is do not lead with price. Sometimes logistics is very price competitive. There's a lot of players out there, but for this market, companies need to lead with readiness, right? The landscape, as we've talked about throughout this whole webinar, is changing, and it's changing very, very quickly. There's different laws. So couple questions to ask as you're considering a partner. One, can this partner actually execute in Mexico? Not on paper, but with proven results. Do they have capabilities across both sides of the border? Because one thing is leaving Mexico, the other one is into the US or into Canada. Every country has its own complexities, right? And do they have the regulatory expertise to actually move the product? Like Hector said, during COVID, we had a lot of different landscapes thrown at us, and the agility of the players is what marked the difference during that period. So having a partner that can shift and has that global footprint to be able to move your product, right, regardless of the situation and regardless of the outcome that may happen, unforeseen, right? Now, it's one of the thing is the stronger partners is one that has that global footprint where you're connecting warehousing, you're connecting the broker, transportation, visibility, that has the fewest handoffs that guarantee your product can get from point A to point B seamlessly. So really it's all about, is that provider ready for what's happening now, or are they equipped to handle the future? And that is the biggest outcome that customers or companies need to consider with this volatility that we're living in.
Yeah, and in the healthcare, because this is such a regulated space, right? I mean, there's no room
Extremely.
for not knowing your products. You need to have your regulations. Having that information ready and understanding what is that regulatory landscape is very important. And Hector, let me move to you. So much has happened in the past 6 years. Many changes. Can you share from your perspective? Because I love that your breadth of table. Um, what lessons do you think has the sector learned? What has been unique in this landscape that you can share, and how is the sector adapting to it, right? From such a heavy regulated sector, right, that depends so much on government compliance, on so many things, would lot. What do you think has been learned? Has been what have been those
So first, I have to say that when you look at the big players in the sector, both in medical devices and pharmaceuticals, though both of them are I would say companies that know very well their business. No, it's very difficult to come from zero and start a business from scratch in both the sectors, since the barriers to come inside the sector are not easy ones based on the investment that has to be done mainly. Okay. Also in the production lines and all the requirements that are done. So I would say, taking that into consideration, the learnings are not so sometimes so basic ones, no, because there are people that they know the business from too many years, and then when you look at the global companies, several of their GMs have worked all around the world. So the day-to-day challenges that they face, sometimes they vary from country to country, but I would say they're almost always the same. So how the company, how the government is buying, how the government is paying, how the relation with government is being built, and how to relate to the key stakeholders to understand what are they looking for and how can they serve them better, I would say. From perspectives that have to do more with the UPS side, I would say there's been a change in the amount of product and specifically AIPs, for example, that had need to be bought. So when you have a challenge and you don't know exactly how much the government's going to buy, if they're going to buy one way or the other, one of the big challenges is how much inventory you want to have. Because sometimes you buy inventory, and if you're not able to win in the price selection in between the companies. Some of them get to win the process of what government's supposed to buy, but the other ones, the rest of the players lose. And when they lose, what are they going to do with all that active principle if it's inside the company? So I think one of the key new understandings is how are we going to adapt inventory to the demand that's really going to happen, and to better understand what the government's really going to buy, and to be able to play in that, in different to what Susie was saying, is fully price related. There's no discussion for government, it's fully price. So everyone within the circle of working with the industry has to understand that's price driven, because 1 cent or 2 cents under between one omeprazole or the other, it's gone. No, so it's extremely price sensitive when you work very close to government. There's no other discussion, because as soon as Cofepris would come and say these two products are exactly the same, then it's all about pricing. So what you have to work together is to making sure that you deliver the best price to be able to win the tender. So I think that's been extremely aggressive over the last few years. The government has done a very good job in lowering pricing. So then the challenge goes back to the producers to say, how am I going to buy better from the AIP sector? How am I going to do the right logistics coming from offshore, and to make sure they come into the country on time, but also at the lowest cost possible, and then how you produce at the lower cost possible to be able to win the tender. If not, you're going to be lost, and you're going to be staying with all that inventory behind. In the private market, as Juan Carlos, maybe I think he was explaining, the private market, it's very small when you look at the amount of units that can absorb. Okay, so if you look at the size of the market, it's a market in terms of units, it's mainly a public market. So if you lose the tender in the public market, then you're lost, and then that's going to have a big impact.
I love it. Thank you so much, Hector. That is so true and so interesting, and how important more it is for the small, medium-sized businesses that are listening to be able to join an organization like yours, right? To have that information, be able to have that education. So I brought Juan Carlos with us because I felt he was feeling alone over there. But to get into the closing, because we're going to start the Q&A a little bit, we have some questions that are going to be introduced. But what I wanted to maybe I'm going to ask a question for the same question for you, 30 seconds or less. I call it words of wisdom. I will call it the words of wisdom from you to the audience. In that, what do you think will define the success of companies in healthcare or medical devices, etc., for the next 5 years? Landscape, what are going to be the characteristics or those nuggets that you think will be important or make a change for companies that are in this area? Susie, 20 seconds or less.
20 seconds or less. Okay, I gotta speed up. I think the winners are going to be those that stop treating supply chain as a cost to manage and start treating it as a strategic enabler. Like, we need to choose partners that are driven by quality standards, that are reliable, and can have the full end-to-end capability.
Thank you, Susie.
Yep.
Hector?
It's about access, and access has to do with having the physicians in time, having this infrastructure ready, and having the pharmaceuticals and medical devices in the place it's needed at the correct price and making happen. To be able to close the access to healthcare, it's about those three factors: people, the right physicians in time, physicians, but also the medical team, then infrastructure, having the equipment working in time and set on time, and then having the medical devices and pharmaceuticals at the right price at the right moment. And that's the only way to close the access gaps.
Yeah, the answers gap. Hector, it's so important, no? So from a Susie perspective, be a strategic and be intentional about how you look at supply chain from your perspective. Access, no, and access, and I imagine, Hector, you tie that in, also having the inventory available for once you got that access, right, to be able to manage. I don't know if the inventory goes into that. I love management of inventory. I'm definitely a logistics nerd from that perspective. Juan Carlos, from your perspective.
Well, I think we are all speaking about lives and health of people here. So being on time and choosing your right partner will be crucial to success in the healthcare sector. Of course, by providing your products, services, and equipment in the right manner, that would make a difference within Mexico in terms of saving lives and supporting the population health. So I invite the companies here to get as informed as they can, about the regulatory system, about who are the key players. I also invite them to get in touch with the different governments that have presence here in Mexico, because we can provide market intelligence about how the market behaves and what are the opportunities that they can find. And of course, if this is a right market for your product, because there are several factors that have to do here, specifically in Mexico, that would determine if your company can be successful or not.
I love that. And that's so important, right? There are tools to help the company to be able to be successful. And I do appreciate that part. If you're a US company wants to get into a Mexico market, there's that tool to help you. And also from Mexico, as I know that today is not the topic, we're only talking about Mexico, but with Susie, we can talk about the rest of the world, right? Because we are seeing that growth. And Hector, you mentioned it briefly. There is an opportunity to grow. So let's move to the Q&A. First of all, if we were in front of an audience, I will ask the audience right now to give you an applause, the three of you, because you were awesome. And I thank you so much for the wisdom and the knowledge that you have shared. There's two questions. I'm going to ask one, and I think, Hector, maybe you can help on this piece. We have an entrepreneur that has the challenge of receiving the payment from government once you deliver. And I don't know if you have any sense from that side on how to manage that logistic cash flow, or what you have heard from your members. If not, we'll get back to an answer on to Marta Elvira to guide her. But Hector, what can you share from your wisdom?
No, I think that when we look at what happened a few years ago, it was worse. Now it's improving, but there's still a pending at this point in time to be able to deliver in time the payments from the government, but still improving. And I think prior to the next tender, it should improve now over the next few weeks. If not, it's going to be a crisis because industry would not like to go inside a tender if they don't have their payment solved.
Mm-hmm. Thank you so much, Hector. I can assure you to Hector's voice, other voices, we have been working up with the governments in terms of the challenges of the payments, right? And be able to have that process. Thank you so much, Marta Elvira, for the question, and I hope we right. We have another question that talks about, from a logistics world, how can digital transformation such as data analytics, automation, and real-time tracking improve supply chain by visibility and patient equals healthcare sector? I don't know, Susie, if you want to comment on it, and then I open up also for Hector and Juan Carlos if complement, because
Yeah.
digital healthcare is changing many things. Yeah.
Yeah, digital technology visibility, it's not only about tracking the shipment, it's about understanding the risk before it even happens, right? And UPS is leaning heavily into the AI, right? Understanding the predictability and understanding what's happening with the tools of forecasting, right? Um, it's not only about telling the customer where the problem is from a technology perspective, is being able to identify that risk, intervene, and protect. And AI is really game changer at this moment because we're really understanding the data from a different perspective and offering much more advanced solutions for customers that can guide them throughout the whole journey.
Hector, would you like to add anything, or Juan Carlos, on that one? You're good? Awesomeness. Thank you so much, Mildred. Thank you for the question. I do want to tell you also, UPS is also a member of a group called Rise for Healthcare that is looking at healthcare across Latin America, and we're looking at those type of discussions. How does digital healthcare have an impact, and then how do you connect logistics to that digital healthcare? That's probably another time for another time on that part.
That's a whole different topic, Maria Luisa. Digital technology, analytics, and predictive analytics is a whole different one in its own.
Happy to join that one whenever you want. We worked out the digital health law that's valid in Mexico was worked from FunSalud. And also we're doing a certificate together with the National Academy of Medicine and UNAM, the Faculty of Medicine, regarding AI in healthcare. So anything you need, happy to work that together also.
Thank you, Hector. And that's very important, that because that is the future in terms of how do we get access to everywhere, right? And be able to help more people on that piece. Last question, because I'm getting we're into PS, we have to finish on time, and I am running out of the 2 minutes. But the last question, would you say that more healthcare companies will invest in Mexico regarding the growth and challenges in public healthcare?
Yes, I think we will see a lot of more companies coming in. There's very active companies coming from Asia into Mexico, and also some of the Latin American companies from some other countries in Latin America also coming. Some small European companies also coming into game. So yes, I foresee a big growth in that.
It's only going to accelerate.
Yes, I agree.
Just to complement the momentum that we've been seeing, it's only going to accelerate between the 5 years. We're already starting to see the shift with a lot of healthcare companies setting manufacturing sites. Remember, Mexico is very, very close to the US, and it's going to serve as a very important hub for the healthcare sector.
Yep.
Right. If I may add to that,
Yet,
as we spoke about nearshoring, and health is a national security priority for the U.S. So keeping, the supply chain on healthcare products, pharmaceuticals, medical devices is crucial for the security of the United States. And we should also consider that there are companies investing also in hospitals and facilities here in Mexico, because there are also uh, the U.S. population is looking for medical service here in
jubilados.
Mexico. So
Yes.
yeah, the retirees and people who don't have, medical insurance or access to high quality services are looking for these kind of options here in the Mexican market. So we are sure that there's going to be a lot of investment in the upcoming years in this sector.
I can confirm my in-laws live in Ajijic in Chiapas
Right.
healthcare. So
The
beautiful,
good thing is the
beautiful
care model
areas
is
here.
changing. It's going directly to the patient's house
Well,
versus it's
yeah.
change is coming.
Mm-hmm.
Yes, it is. It is here in some areas. Thank you so much, Susie, Hector, Juan Carlos. I gave in the order of my windows that I have. I really appreciate your wisdom, your time, and your knowledge. This is very useful. I'm going to switch to Spanish because vamos a tener el próximo webinar, va a ser en español y vamos a charlar más de cómo vemos el tema de la salud en México y en Latinoamérica. Estamos viendo ese proceso porque hay cambios, como yo creo que algo que mencionó Juan Carlos muy importante, cómo está, cómo se dice, uy, ahora sí lo voy a decir horrible en español, pero los que estamos envejeciendo, estamos acumulando juventud y sabiduría, pongámoslo desde ese punto de vista, vamos a necesitar más servicios médicos y eso, cómo es esa logística y cómo funciona. Entonces, seguiremos la conversación. My speakers, they are awesome. Gracias, gracias Juan Carlos,
Thank
Gracias a
Héctor,
you.
Susi,
todos.
que estén
Gracias,
muy
fue un
bien.
placer.
Y gracias a todos por la participación y que le vaya bien a México, a Colombia y a Estados Unidos en el Mundial.
Vamos
Tenía
mundial.
que decirlo.
Muy
Vamos.
bien.